Hello, you clicked the right link at the right time. Welcome to our community talk show here on Bwera Online TV. This program was specifically packaged for you. It's gonna be mind-blowing. By the way, who am I? Trust Panda UG my name. And let's not waste much of our time. Let's jump right into the show. Besides me, I got the public health scientist. Dear sir, can you briefly talk about yourself?
Okay, thank you very much. Thank you very much to the online TV Bwera for giving me an opportunity, and I want to convey my warm regards to the viewers of this renowned TV within our community. I'm called the Bwera Arafat. I work with the Bwera General Hospital as a public health scientist. At the same time, I work with the Great Lakes Peace Center, a grassroots youth-led organization. I'm a health program manager. Thank you very much for giving me the opportunity to talk to the viewers.
Yes, sir. According to the World Health Organization, hepatitis B has been proven as a very dangerous disease. It has gone so very viral in Uganda, particularly in Uganda. So, sir, I would like to ask you to give us more light about hepatitis B. What is hepatitis B?
Okay, thank you very much for your good question. Viral hepatitis B is a liver disease that causes the liver to inflame and it causes the damage of the liver, and it's caused by the virus of viral hepatitis. Thank you very much.
Yes. We have had so many diseases that can chew. Why is hepatitis B so dangerous? Why does it become so dangerous and so different from these other diseases? And how is it transmitted?
Okay, thank you very much for that wonderful question. Why viral hepatitis becomes very dangerous in our communities is that at the moment, viral hepatitis has no cure. But the good news is that viral hepatitis can be prevented by vaccination. But specifically, you've also asked me that how is viral hepatitis spread, or how is it caused? One of the ways how it is caused, it is coming into contact with blood of a person who is infected with viral hepatitis B. The other can be from the mother to child transmission. The other way is through sharing of sharps. For instance, the razor blades, the scissors, if they are shared, or during tattooing. Most of the young people or other people go to the places and they are being tattooed with sharps, and these can cause viral hepatitis. Thank you very much.
So, how can one come to know that he has hepatitis B? Or how can I know that someone around me has hepatitis B?
Okay, maybe before we also go to how does someone know, it is also important that we clear the myth where most people think that touching someone, hugging someone, or greeting someone, or eating together, or sharing utensils can cause viral hepatitis. Because at the grassroots, most people think that if you touched or if you had shaked someone, if you shared the same utensils, if you shared the same meal with someone suffering from viral hepatitis, it can easily cause viral hepatitis. That one does not cause viral hepatitis B. But importantly, the question you have asked, that how does someone come to know that you have viral hepatitis? The only sure way you can know that you have viral hepatitis is, one, to come for screening at the health facility point or health service delivery points. You are screened and then tested for viral hepatitis. That's the only sure way someone can know that you have viral hepatitis B. Yes, thank you.
I wanted to ask you, if someone has hepatitis B, can he still get the COVID-19? Or someone with hepatitis B, if he gets COVID-19, what happens?
Oh yes, COVID-19 and viral hepatitis. If I have viral hepatitis B, can I be able to get COVID? That's for sure. As long as someone is suffering from viral hepatitis, that does not exempt you from getting other illnesses. In fact, you become so prone to other infections, including COVID-19. The most important thing during this global pandemic of COVID-19, it is to ensure that we continue social distancing, ensuring that we wash our hands all the time, to ensure that we are not able to touch the 3 points, the 5 holes, the 2 eyes, the 2 nostrils, and the mouth. And then the other thing is to keep at home and putting on the masks. So if you have viral hepatitis, yes, you can still contract you can still contract COVID-19.
So what challenges do you face when trying to sensitize the community about hepatitis B?
So you've asked me that during this COVID-19, some of us who are at health facilities that render the services of viral hepatitis services, what are the challenges that we go to? Of course, there are very many, including the restrictions that we have. One of them is the continuous long distances. You need to move from Bwera Hospital and you go to the deep sides of the mountain. The other thing is the stock out. If patients are on treatment, it's difficult for them to come and pick them now because they need to move all the way from their areas to the general hospital where they come and pick the drugs. And also the drugs, sometimes they may not be there for them, they may not be always available. The other challenge is that the vaccination and screening is done at a static point, it's done at one point. The other thing is that the challenge is that the services of viral hepatitis are not integrated into the SI screening, and also they are not integrated into the HIV system. So the HIV patients have all it takes. The services are there, the implementing partners are there, but the people who come to seek for services of viral hepatitis do not have implementing partners. The services are not integrated into the healthcare system. And then also, we have not had commitments in terms of investment. We don't have a lot of money coming to attend to the people suffering from viral hepatitis. Because let's face it, let's not bury our heads in the sand. If we want to concretize and enhance service delivery in terms of healthcare package of viral hepatitis, we must have the funds. So those are the challenges that are still there.
Yes. Thank you. Dear sir, it was my request that you should briefly talk about the Great Lakes Peace Center, though it's not part of our theme today.
Okay, thank you very much. Great Lakes Peace Center is a youth-led organization that champions the peace and health model for all. It was started by some of us who are the founders of the organization, with the subscription of very many young people within this region, and whose thematic areas include peace and conflict resolution. Rwenzori region is prone so much to conflict, and we think that peace is not mere absence of war, but rather social justice, accountability, and transparency. So Great Lakes Peace Center is a hub to incubate and innovate ideas on how do we concretize and enhance peace within the Rwenzori region at the national level and internationally. The other thing Great Lakes Peace Center does is the peace and health model, because we believe that you can't talk about peace when you don't have health, because also health is not mere absence of disease, because we need to have people who are healthy. We need to have people who are socially well. We need to have people who are morally well. We need to have people who are also mentally well and spiritually well. So that's the model we are trying to implement.
Yeah, can you give out your last word to the viewers, to our viewers of Bwera Online TV, and most especially to the young people who want to be like you?
One is that the viewers out there and the young people who want to be like me, the most important thing is that one is that they must have discipline. Two is that they must ensure they keep in school until they finish school, and if they want to become public health scientists, they have to have a career in science subjects. They need to, while they're at school, they must be able to study science subjects to ensure that they are able to become public health scientists. The other thing is that we must be aware. One, we must be aware of viral hepatitis B that is in our communities. Then two, we must be aware that people need to be screened. Number three, we need to be aware that we need to be tested. And we must be aware that in an event you are negative, you must come to the health facility to be vaccinated. And for those who are viral hepatitis positive, they must be aware of their status, and they interact with health workers to ensure that they guide them through treatment and care. and preferably they should always come to Bwera Hospital. Finally, in our global efforts to eliminate viral hepatitis, it's just 10 years towards the Sustainable Development Goal to achieve the elimination of viral hepatitis. There are around 4 to 5 prescriptions which we are trying to call upon some of us who are viral hepatitis champions. One is to have all the heads of states or governments to ensure that they have the political will. Then the children who are born are able to have hepatitis-free future, because we shall have prevented it from that point. The other thing is to encourage the pregnant mothers to always deliver from general hospitals like Bwera Hospital. They must be able to come so that the health workers are able to work with them. Then finally is the commitment of resource mobilization. We need to get the money and help to deliver the viral hepatitis service delivery. Finally is to integrate the viral hepatitis B, the viral hepatitis health services into the STI and HIV screening services, because we are acutely aware that the system is there and it can work concurrently. I thank you very much.
Thank you, sir. Presenting with you has been so enjoyable. It has been so loving. Thanks for giving us your time. And to our beloved viewers of Bwera Online TV, we humbly request you to subscribe to our YouTube channel to watch a bunch of our live shows. We love you. Stay safe till we meet next time. Bye-bye.